back to the new norm. I'm Dr. Lou Graham, and this program is brought to you by Midway Dental and Catapult Education. So for most of us, we've been maybe seeing sporadic emergencies in our offices, and really we've been almost in a virtual full profession shutdown for the most part. As we wait for PPEs to get really sent to our practices, and we want to get back to practicing dentistry, I wanted to reach out with you, really to all of you, with some thoughts. As restrictions start to ease, whether it's going to be at the end of April, May 15th, May 30th, or June 1st, no matter what the truth is, we're in a risky spot as a profession. I'm not creating fear and fear-mongering, but we're in a risky spot, and we're going to have to use our heads to get through this. Because without a vaccine, there is no norm. Without testing and contact tracing, there's really no norm, maybe a new norm. And without really affordable treatment that really works patient by patient, we really won't be in a norm for quite a while, is how I look at it. So with that, I thought history was very interesting to look back at. And I'm going to take us back to 1918. So in 1918, the swine flu H1N1 hits. And it's a bad virus. And what really transpired through that time frame was that the virus itself, when it hit, and it hit globally, of course, with millions killed, when it hit the US, it came in 3 waves. Yes, and this isn't, again, this is a corona type virus. I mean, this is, again, the same type of virus we're dealing with. So it happened in 3 waves. And in total, 675,000 Americans died. And what was really interesting at the time, and you'd think, oh, this is all new to us. It's not new. What were the recommendations in 1918? Wash your hands, social distancing, avoid large gatherings. It's the same recommendations. And even back then, they were talking about flattening the curve. So everybody thinks, oh, flattening the curve is new. This is 100-year-old. This is what epidemiologists have been studying now for years and years and years. So there are some really interesting points about the virus. Some said it wasn't more virulent than the flu. I mean, we hear that today. Though this flu is definitely more contagious than the flu. And was it more virulent? Or did people die based on the fact that there was overcrowding in hospitals, the way it was all set up, malnourishment, poor hygiene, bacterial superinfections, because there were no antibiotics? All of these are all additional reasons why this virus took so many people. And what's also interesting is one of the theories also was it took a lot of people in their 20s and 30s. And they called it this super cytokine reaction, where the body's own immune status created this response. And potentially that is why people are dying today in that age range of 20s and 30s and 40s without any medical comorbidities. And there's still so many questions. Why do some people why are some people up to 40 or 50% asymptomatic, and others, it just totally destroys them? I mean, it just takes them all out. People like my buddy Brian said he's never witnessed anything like this. He had it for 2 weeks, and he's never felt this, and he's still dealing with waves 2 weeks later. With all this said, I think it's really interesting to go back and learn a little bit more about what history has taught us. So they were comparing Philadelphia in 1918 to St. Louis, Milwaukee, and other cities. And what happened was that Philadelphia decided to have a parade. It was 1918, and they wanted to have a parade. The governor said no, the council said yes, the mayor said yes. And so what happened was they had a parade in the middle of the flu, in the middle of this whole thing. And within 3 days, the hospitals got overwhelmed, and 2,600 people died within a week. And what's interesting is when you look at the city like St. Louis, they didn't have a parade. They were practicing social distancing. They were, again, everybody's wearing masks. That's what was recommended, but they were practicing social distancing to the T. Businesses were shut down. And when St. Louis relaxed their social distancing is when the second wave hit. And immediately they saw the numbers go up. They went right back down to social distancing. And the bottom line was that St. Louis, Milwaukee, other areas, they acted very, very responsibly. And I just want to say this. So what did the numbers show? Those areas had half the number of deaths per 100,000 inhabitants. So for every 100,000, those areas that practice social distancing and what we were talking about, proper hand washing and everything else, had half the death rate as Philadelphia and other East Coast cities. And it was all about flattening the curve. So I think it's really, really important to understand what we're seeing. And what are we seeing on TV? We're seeing people marching for their rights, not respecting social distancing. And I understand rights. I want to get back to business. So does everybody else. But it's all about respect. So in San Francisco this week, a restaurant that had curbside service shut down because people were not following their wear a mask when you pick up your food and social distance. The workers felt very uncomfortable and the restaurant closed. Why do I bring that up? Well, when you develop a protocol in your office, and you're going to develop a protocol, and if we tell patients we'll meet you outside and we're going to put a mask on versus those patients who just walk in without a mask, do you want to see those patients who are not respecting you? I don't. What about when you're screening patients and you're not really believing their story and they're not necessarily telling you the truth and you want to recommend testing and then they don't want to be tested? You want to see those patients? Or what about the patients who you're screening and they're telling you the truth and you know what? They need to be tested, whether with a PCR test or an antibody test. Again, that's subjects we've already come to. This is all up to each one of you how to practice safely. I'm going to follow the epidemiologists. I'm not following politicians on this. I'm following the experts on how best to keep my safety and my patients safe and my team safe. And with that, and I say this, we've got a lot to learn. So for example, when I'm using aerosol or my hygienists are, I'm going to want N95 masks. We're going to learn more about air filtration systems. We're going to have to up our OSHA. We're going to have to be doing pre-rinsing. We're going to have all these protocols. We're going to have to follow protocols, at least in the near norm. We're going to have new suction vac systems, maybe for hygiene, where Dentsply's come out with a really cool one that's got a mirror on it, and a hygienist can do this. Or we can use systems like PerioProtect to minimize aerosols because we can use more hand instrumentation and then maybe just a little ultrasonics. There's many, many different things we can do. Here's what I know. After wearing an N95 mask for 3 hours, 8-hour days are going to be really, really challenging. Really challenging. And I think what you all have to understand is that by screening will allow you to practice, it will allow you to practice safer. Because the more you screen, the more you know about who's coming into your office, and you know whether they're at risk, at no risk, or somewhere in between. So let me say this to you. So let's say a patient comes into your office and they walk in, and now there's a waiting room full of 4 people because you don't believe in social distancing, and a lot of your patients don't respect social distancing. Is that how you want to practice? I don't think so. Let's say all of a sudden there are 4 patients in your waiting room, and your patient walks in and you say, well, my screening is I'm just going to ask them whether they have any symptoms before they come in. And then I'm going to walk them in, I'm going to do a thermometer reading, and if they're normal, we're good to go. Fine. Then whether you do a pre-rinse, which I recommend, or a pre-brush, whatever. Now all of a sudden, the phone rings 3-4 days later, and the patient you saw who had no temperature, no symptoms at all, which could be up to 40 or 50%, by the way, of all COVID-19 patients, calls you up and says, You know, doc, I'm running a low-grade fever. And you know, doc, I was out with a group of friends the weekend before my appointment, and 4 of them have a low-grade fever and 2 are not doing well at all. What are you gonna do? What are you gonna do? You're gonna call all those patients who were in the office that week or the week after? What about your staff? How are you feeling? How's your team feeling? What are you gonna do? Why don't we try to minimize that patient who walked in? If you would have asked him some key questions, this could potentially have been minimized. So what does that mean? What it means is if you're asking a patient, do you work from home? And they go, I work from home, they're lower risk. If they're working in a high risk area and they haven't been tested, don't you want to know? Wouldn't you want to test them? Whether for the virus or the antibody, wouldn't you want to know? And what if they're not practicing social distancing and they go, I don't believe in social distancing? Would you want to know that? What if all of a sudden their son moved home and he's been running a low-grade fever? Not the patient, the son. Would you want to know that? These are simple questions that can alert you on a risk level of no risk to super high risk. And to me, I think that's critical, because if you have an 86-year-old patient in your chair who's not in a senior assisted living home and you're doing work on her, you want to maximize that patient's safety, like every patient's safety. So this is what I'll just say, and I keep re-emphasizing this. You must be smart. Learn from history. Know there will be waves coming. There will be another wave. Know that people will be traveling interstate. Understand more people will be lower. You'll have lower risk patients and higher risk patients. It's all up to you on how you want to screen, test, and practice safely. My thoughts. Lou Graham for the new norm. Thanks so much. So let me be clear. We want to hear from you. We want to hear your questions. So what we want you to do is we want you to go to education@midwaydental.com. Shoot us your questions. We'll go right to the experts. I know I'm not the expert, so let's go ask the experts what we should be doing as our next step next week, the week after, and thereafter. I look forward to hearing from you.